Hi everyone, welcome back to Healthpedia, where we make healthcare simple and accessible for everyone. I'm Dr. Arshad Khan, and today we are going to divide into a crucial topic: first aid for burns and scars. Burns and scars can happen in an instant, whether you are cooking in the kitchen or out in the sun. Knowing how to respond quickly and effectively can make all the difference in healing and recovery. So today in this video, we are going to discuss about the first aid made for burn and scar. So let's start it. A burn is an injury to the skin that happens from touching something hot, scald or burn from hot liquid or steam. If your child get a burn or scald, first make sure the area is safe and there is no risk of further injury to your child or yourself. Take your child to a safe place if possible. Remove any clothing, watches or jewelry around the burn immediately. If they aren't stuck to the burn, leave any blister alone. Hold the burn under cooling water for 20 minutes. You can cool the burn for a few minutes at a time over the next 3 hours, but don't delay getting medical help for severe burn. Cool the burn, not the child. Stop cooling the burn after 20 minutes. Keep your child warm because hypothermia can happen quickly in the child. After cooling the burn, recover it with a loose, light, non-sticky dressing like plastic wrap or a clear plastic bag. Raise blister limbs to reduce swelling and pain. Call an ambulance if the burn into your child's face, airway, hand, or genital or is larger than the size of child's forearm. Go to your general physician or hospital if the burn is a size of 20 cent piece or larger, or if it's deep, raw injury blister. Also, do this if the pain persists or is severe, or you don't sure how bad the burn is. Don't apply ice water, lotion, moisture oil, ointment, butter or flour or cream or powder to the burn. This will make the damage worsen. This was all about the first aid of burn and scald. For more updates like this, do subscribe to our channel. Take care, see you on next video.